Good day, and thank you for joining us for this continuing series on financial matters for surgeons and retirement planning. I'm pleased to be joined again today by Dr. Mark Aeder. Mark, thanks for being with us.
Thanks, Pat, for having me back.
So, Mark, I know in our last video, we talked about how much money that you would need for retirement, and that got into being somewhere between $3 to $5 million, and it sounded like an awful lot of money based on how much of the principal that you were taking out every year. So what is it that you would say to those of us who might not be exactly where we thought we should be at this point in time in our career?
Well, first of all, it's a lot of money. It really is, to put away, to park away for a time in the future. And that is an ideal scenario. The one thing you can do is realize that you're going to need a lot of money and then make every effort now to maximize. You can't go back and change what you've done. What you can do is you can change your processes going forward. Now, the way you do that is you're going to have to see what your expenses are going to be. And like we spoke before, when we tried to make a budget, what you need to do is back your budget into how much you're going to need each year. You don't want to take all this money out at once. You just want to take out 3.5%, 4% a year. That way it can cover you for your 20 to 30 years of retirement.
Yeah, and we would just remind folks that, not familiar with doing that sort of a budgeting process, that the Practice Protection Committee's website on the FACS web page, you can get links to it, has got a survival strategies document, an exercise that we put forth to help you do just exactly that.
Right. And if you use that, things are going to go up in retirement that you really didn't anticipate. Healthcare costs, you're going to have to pay taxes on a lot of this money, living expenses. We have inflation every year. If you just kept your money in cash, it's actually going to lose 3 to 4% a year, or the rate of inflation every year. So you have to invest it. And the way you're going to do that is you have to take some sort of risk. As you take more risk, generally the percentage return increases. So over time, times your risk, then you should have an increase in the capital that you obtain. It's really hard. I mean, most surgeons don't like risk, right?
Well, we're taught, one of the things I was always taught is to avoid risk at all costs. That's kind of inherent to most things that we do as a surgeon is to become very, very risk averse. And it's inherent to our nature to not want to particularly put at risk our hard-earned dollars.
Exactly. I find most physicians are fairly risk adverse. Surgeons a little bit less so. Just because of the nature of who we are, but we're still risk adverse in general. It's an area that we don't really feel comfortable with. It's not our area of expertise, and it becomes very easy for us to be led down a path. And if you have a bad outcome, it makes you even less risk worthy. So there's reasonable risk and there's reckless risk. And what I want people to think about, the reasonable risk is a well-structured risk. Reckless risk, well, I mean, you probably have your own description for that, I'm sure.
So with regards to the risk, Mark, how do we sort of manage that for ourselves? What are some of the tools? I mean, we've talked prior to the recording today, we talked a little bit about the rule of 72s and bonds and how that's going to take you so many years to recoup that. But for a more reasonable assessment of our risk, how do we best manage that?
There's one tool that many financial advisors use, which is called the rule of 72. And what you do is you take your average rate of return over the year after expenses and divide that into 72. And that shows you at that rate how many years it will take you to double your money. So if you're looking at a 4% annual rate of return, if you're in your bond portfolio and some mutual funds, and after expenses, you made 4% this year. It's going to take you 18 years to double your money. That's not reasonable. If you can increase that after expense rate of return to 9%, it's going to take you 8 years. A little bit more reasonable with the capital you're going to need. If you can move that up to 12% a year, which many people will think, well, that's really risky. To try to get 12% a year is pretty tough. But just to put it in perspective, that's going to take you 6 years. So the money does not double easily. But if you keep your money in very low rate of return just because of the safety and not stepping out to the risk, you're barely going to be keeping up with inflation. Certainly out of whatever you earn, take away inflation, take away the taxes, you may actually be negative in spending power.
So, referencing some of the other work that the Practice Protection Committee has done, we've talked about putting together the team that we need to help us manage our financial affairs. And a key person in that team is our financial advisor. And how do financial advisors help people best to be able to manage their risk, especially, those that are risk averse?
Well, it's like somebody coming in to visit you as a surgeon. They have a disease. You have to talk them through this. You have to try to talk them into treatment alternatives and strategies. It's the same thing your financial advisor is going to do for you. If you have a good person doing your financial management, they're going to listen to you, find out where you are, where you want to be, what you need, and they're going to structure this in order to help you get there. That's just the same way we get the patient through the operation. They need to get you through your life. So it may involve them talking you through accepting more risk, that we're going to have some money here it's going to be a little volatile. Don't check your account every day, because some days you'll get heartburn and some days you'll get elated, and it's going to be a real seesaw for you. But let's look at it over time. But if they know that you have 8 or 10 years to retirement and you're sitting on a portfolio that's not going to be adequate for you to really maintain your current lifestyle, then they really have to structure that for you in order to be able to get your money to double over those 8 or 10 years that you have left in practice. Your responsibility is to communicate often with your financial advisor. Get your results, find out how you're doing, talk, restructure, and as you need. I always say I never get personal about a holding. I may really love a company and all, but this is business. I mean, it really is. If it's good for my portfolio, if it's good for my family's long-term health, then that's where I need to be. If it's no longer meets those needs, doesn't matter how much I like the particular company, it's out of the portfolio. So the financial advisor, a good financial advisor, will be totally on top of this for you, especially since you're baseline a high wealth individual. And so this is something that they really take a lot of care when they start to formulate their plans.
So basically, your financial advisor should be able to provide for you what a reasonable expectation, a reasonable rate of return is based on your individual circumstances, on how much principal that you have already invested, as well as what your time horizon is before you're thinking that you may want to retire.
Right. They have to have this. Really, from their experience, they have to have this out. Now, nobody can predict the market. Nobody can predict events. We could not predict a pandemic or a meltdown of 2008. There's just no way of putting that into any equations that you have. But over the course of time, this sort of investment in equities over time has been the most, if you will, the most rewarding. It can also be the most trying. If you're in the wrong equities, or if you're in the wrong sectors, you can be devastated. It's your financial advisor's job to keep you where the market not only is, but actually where the market is going to be. The really good ones can anticipate what's going to happen just based on their experience. So you have to put a lot of, it's tough for a surgeon to hand over control to somebody else, let somebody else drive the car, but you, in some cases, you just have to, if you trust your advisor, you have to trust their expertise. And again, just putting your entire investment in a 4% or a 5% annual rate of return is not going to have your money grow maximally.
Great, Mark. Thanks for that again, for that wonderful advice. You know, what I heard us talk about today is even if you're not where you think that you need to be, you need to not give up. You need to, you know, really have a real objective look at things, try to make some decisions based on data you get from a budget. And we provided resources on the Practice Protection Committee website to help people do that, and then to engage with their financial advisor, try to determine what a reasonable return is for them based upon both their principal and their time horizon, and then engage in a more active interaction with your financial advisor on a regular basis. You know, maybe next time we can talk about what the definition of a good year is and that sort of thing, and get a little bit more in depth into this. In the meantime, I would just note for folks, as we go into this second surge of the pandemic, that there are good resources available for you on the Practice Protection Committee website, and encourage you to go there, take advantage of those. And we'll look forward to seeing you with this next in our series of recording on financial survival for surgeons and retirement planning. Good day.